Okay, so today I am at Lamb Facial Plastics, and Dr. Sam term is, but he's going to do a facelift, neck lift of this area, and I am so excited because I am 58 years old, and I don't feel like I look on the outside like I do on the inside. I guess I should take this off. There. And the reason that I'm coming in is having this procedure done is because of my jowls. This is ridiculous to me, and I don't like that. And of course, you're seeing more of a slack in underneath the neck, and I want to be able to be like this and just look on the outside like I feel like on the inside. And I'm super excited. I was referred to Dr. Lamb by Dr. Tiffany Miner. She's a dermatologist, and I went to her initially for maybe a little bit of Botox, and I didn't know what I could do with this. I had no idea. And so she suggested that I come out here, and once I did, and I saw some of the before after pictures, and decided that now is the right time in my life to do this. Not too early, and it's not too late, so I wanted to just be able to keep up and maintain how I feel, how I look on the outside to how I feel on the inside. That's the main thing. Surgery is tomorrow morning. I am so excited. I've done everything that the doctor said to do. You don't take the blood thinners, you don't drink alcohol, you don't take vitamin E. You do take extra vitamin D and reduce your stress levels. And I'm really excited. And I'm happy to share the before after with everybody. I want everybody to see what this can do for you, not only physically on the outside, but then how you feel mentally on the inside when you look in the mirror. That's the main thing. Thanks.
So we just finished the facelift. The word facelift is a bit confusing because people describe it for all different purposes. What I describe it is lifting this area, and this area. If you want to know details about what I do, how I do it, why I do it, listen to my virtual consultation on facelift. But I'll just talk to you about this patient's story of what I've done to help her out. What I've really worked on, she had very, very large jowls. And so lifting very large jowls is not necessarily the answer by itself. I suctioned through micro-liposuction quite a bit of fat from her jowls. And so that was actually a world record for me. In 20 years of practice, I haven't taken that much fat out, suctioned that much fat out of the jowls. But of course, just suctioning the fat out of the jowls is not good enough. You have to lift it. So the other unique characteristic she had in her face was she had platysmal bands, which are these two saggy muscles that went all the way down to the sternal notch. Sternal notch is where your chest starts. So it was very, 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 very long banding. So I had to sew those bands together from top to bottom. That took me over an hour just to make those areas come together. And then like a hammock, I lift up the jowls, I lift up the face, I lift up the neck, all as one unit. So she had I think she's gonna have a really, really nice result. One thing I could not give her because she's on hormone replacement is something called TXA or tranexamic acid, which further reduces bruising. My mentor always said that there's no amount of ice that can replace the gentle hand of a surgeon. So I'm very gentle, and that allows my patients to have very quick recoveries and very minimal pain. However, because she can get the TXA, she may have a little bruising this week, we'll see. I do use these little suction drains for a day or two. That really takes down a lot of the bleeding. So hopefully she'll have a nice recovery, and you'll follow that progress. Procedure, a face and neck lift. Just to clarify with the people listening to this is that she has been very kind to allow me to film this. I never ask a patient before surgery whether I could film them because I just don't want them to feel as if ethically that I'm going to do something different if I don't film them. But she's actually been so nice to do this journey for us. So I think it's going to help other people. You know, I rarely get a facelift patient this open to be able to allow the filming. So she is one day after the procedure. I was able to film some intraoperative videos. What I asked Denny during the filming is not to film anything gory. Unfortunately, you know, if you like that kind of stuff, you're in the wrong website because I simply don't like to do that. So You're one day out from a full face and neck lift. How are you feeling?
I actually feel fabulous. It's a little tight. It's more of the sensation that I have clothespins underneath my neck.
I did put those in there. No, just joking.
Well, they're working. I can feel it. But the second I woke up and I looked at myself, I was just ecstatic because I know I'm swollen and I know this is all going to go away. But instantly, I saw myself as a younger person. So I'm just thrilled.
So not too much pain though.
Yeah. Oh, no, not at all. Not at all.
And that's a huge thing, is that I just want patients, prospective patients out there to know that my patients really don't have a lot of pain after this. It's very common to have very little pain. I would say the vast majority have very little pain. Occasionally I get someone, like probably 1 in 100, that has some achiness in a certain area. And believe it or not, a drop of Botox will actually wipe it out, because it's usually just a great auricular nerve that gets a little bit irritated, and a drop of Botox will wipe it out. But vast majority don't hurt. And you can see that she really doesn't look bad for a day out from the procedure. And a lot of my patients oftentimes really don't look bad compared to other places. My mentor always said that no amount of ice can replace the gentle hand of a surgeon. And so that's really important. Now, she's got these ugly drains in place. These drains are the second reason why my patients have typically, hopefully, not very much bruising or swelling. Now, unfortunately, because she's on hormone replacement, I was not able to do the tranexamic acid, or TXA, which basically wipes out bruising completely. But I'm hoping that we can have minimal bruising. Now, she had a little bit more output last night from these drains than I would have liked for me to remove them. About 85% of the time I'll take the drains out of day one. In terms of safety, in terms of hematoma, things like that, I'm not really worried after the first day. But I'm going to go ahead and keep them in for one more night. She comes from quite a bit of distance, so I apologize for having her come back, but I think just to minimize bruising for the second week, I think it's worth it. Some of the things that I mentioned during at the end of the procedure that I did for her is I micro liposuction. Now, the reason I use the word micro, that's right, the jowls out, is that if you use a big cannula, you're going to cause a lot of swelling, bruising, and it's not a very accurate way to remove fat from the jowls. So I micro liposuctioned actually the most fat, I hate to say, in 20 years of practice. Just kept them coming out, because you can't take a heavy jowl and just lift it. You got to actually reduce the bulk of it before you lift it. So I use the same cannula I use to inject fat with, which is a very slender 1.2 millimeter tulip cannula to harvest, to suction the fat out. And I did that first. So that was the first thing. The second thing I did was tie the banding. The banding are the two vertical stripes that go down the neck, all the way down to the chest. Point to the little where it starts. Hard for me to do this. Can you point to the beginning of the chest here? Right, the bottom, right? That's right. No. I tie it right to there. That's right. So you can see the distance that I covered. It's quite a bit of distance that I tied the neck bands together. So all the way from the top of the chest, to the top of the neck, all the way down to the beginning of the chest. So that way, that area that's sagging with the two bands is now obliterated. And then I released all the deep tissues and then lifted her up on the sides. And you can see that even now, a day out, the scars should be virtually undetectable after a few months. So typically my patients don't have a lot of pain or bruising. Now, I can see some early bruising occurring in the neck, and she may have some bruising there, probably more than the average patient because I couldn't give the TXA. But I think she's going to, and it was a much more extensive neck elevation for her. But this is a great example of someone where I aggressively liposuctioned the jowls, did a very, very long, extended neck elevation, but she has almost no pain, and right now looks not very swollen or crazy looking. A lot of my patients think at day one they should be looking like an elephant stepped on their face, but that's again that's somewhere else. That's not in my office. So again, this is rare that I get a patient so kind to actually before the procedure to allow me to do the filming, but this is just going sort of a narrative of one day how someone looks.
Hi. It's 48 hours now since I've had my surgery, and I couldn't be happier. I want to let everybody know that I have no pain. I guess the biggest sensation I would say that it was is like you almost have like a clothespin underneath your chin.
The ear area and back behind the ears, no pain whatsoever, no pain. There's tightness, you know, I can feel that, but it will subside. And I'm doing exactly what the doctor said. Today I got my little drain tubes out. That did not hurt. I barely even felt it. I'm just telling you. As far as the neck looking all kind of wonky right now, don't worry about that. It's going to settle down and it's going to smooth out. I'm not worried about that at all. I am so pleased to look in the mirror and to see this. And what's crazy is the doctor said that I had more fat in my little jowls than he's seen in 20 years. And I'm so glad it's gone. It used to hang down and now it's gone and I'm so happy. And I'm just gonna say, if anybody is contemplating doing this, don't hesitate. Do it. You will be happy. This is for me. And when I look in the mirror, I'm excited. I feel good. Today is day 7 after my surgery, and I'm really, really pleased with the results so far. Dr. Lamb says that I'm coming along just the way I should be, progressing. Now, knowing that I did have a lot more bruising than is normal, probably than most of you will have, because I was on hormone therapy, and it was quite extensive, the sagging that I had in my neck and then my jowls. But I'm really pleased with it. This does not hurt. This does not hurt. My ears don't hurt. Actually, nothing hurts. It feels a little tight, and I look a little ratty today because I haven't taken a full shower yet with my hair. And Dr. Lamb says now, of course, I can take the shower. And these stitches dissolve. I didn't know that they all dissolved, but that's pretty cool. No pulling. And I just, as far as like I feel every time I look in the mirror, it's a little weird underneath the neck, but all this, the lumpiness, the crease, it's all going to even out. Not to worry. And you see little changes every day, but I'm really, really pleased with it, and I can't wait for 3 more weeks to go by and a month, and then we'll just see what I look like. Maybe even with makeup and everything and my hair done. But I'm very pleased, and I'm happy to share this with everybody.